Good evening. A warm welcome to this episode of the month-long e-campaign on breast cancer awareness brought to you by IHW Council in Novartis, India. This is the second edition of the Breast Cancer Action Month, where we will bring together all stakeholders, be it policymakers, experts, oncologists, social workers, influencers, and cancer warriors who have successfully overcome breast cancer on this platform to create awareness about the disease and motivate everyone to take proactive action to reduce its risk. We believe that even if one life is saved because people are talking about Breast Cancer Action Month is a success because this killer has been devastating families, wrecking dreams, and causing immense strain on the healthcare system at a time when we are fighting a pandemic. October is observed world over as Breast Cancer Awareness Month, and we dedicate our efforts to the brave ladies and men who are fighting this disease. Let's do a recap of all the ground we had covered in our campaign last year.
Breast cancer is the number one type of cancer in women today.
मुझे आज ब्रेस्ट कैंसर एक्शन डे से उम्मीद है कि जागरूकता और उपायों के बारे में लोगों को बताकर हम देश में ज़्यादा लोगों के बीच कैंसर होने से रोक सकते हैं.
I'm confident that the contribution of the Integrated Health and Wellbeing Council will certainly help in checking and treating cancer.
That this is preventable, provided we feel ourselves on a daily basis. We love our bodies, we value them and take care of them.
Awareness around cancer, awareness around women health, awareness about around all the artificial things that we engage in, and vanity has its own impact on our health. And I think it's time to turn the tables on the other side.
In order to defeat breast cancer, it really takes a village. In other words, it's take a holistic approach, not a silo approach.
The problem is really at two levels. One is, like I said, with the media centering a lot of communication around what is significant in that month. And the second is, as a society itself, we just don't want to mention the word breast.
We have to create a complete ecosystem which can really help early detection, early treatment, and help patients live a longer and healthier life.
Make sure that you put the patient at the absolute center of any solution that you design.
We have to educate them to do their self-examination first and to encourage the women to go for tests, which is very, very important.
I see role for each and every one to come together and, make this Indian healthcare system a very robust one.
Nothing stronger, this applies to than cancer prevention as well as early detection.
Over the last 10 days, we have heard oncologists, social workers, influencers, policymakers, and cancer warriors talk about breast cancer, and everyone agrees that early diagnosis is the key to fighting this killer successfully. We have also discussed medical advancements and how they are helping to improve the treatment and quality of life of patients. Here are some highlights of what our experts have discussed on the shows of this year's Breast Cancer Action Month.
Welcome to the second Breast Cancer Action Month, a mega month-long movement to strengthen awareness about breast cancer and encourage action against this fast-growing public health menace.
As for any other cancer, and so it is true for breast cancer, the mantra is early detection, and early detection.
The bottom line is the lady should be made breast aware.
Number one, clinical examination. Number two, an ultrasound if a lady is young lady as Neha, or a mammogram if they're above 40, and a guided core biopsy. Triple assessment, 99.5% will give two answers. It is not a cancer or it is a cancer.
The multiple level work is required to diagnose early so that we can cure most of the patients of the breast cancer.
We are going to get better. The diagnosis is going to be early, and hopefully patients, individuals who are unfortunate to get the cancer will be fortunate because they will get access to better and better treatments.
Our objective for ongoing research in breast cancer, not just breast cancer, but also in all cancers, is to have patients with early disease to have as long as possible the remission period.
Always we do the contact of the patients along with the cured patients. So cured patients will tell them that, okay, nothing to worry. I was suffering from this cancer. I have taken this treatment, and at present I am completely cured.
It is the fear that we need to understand. What is it that the woman goes through when she is diagnosed with breast cancer?
Not for diagnosis or of cancer, but we would like the person to be familiar with a normal breast. The individual should be familiar with a normal breast.
Our country needs education of women, every woman. Every girl who attains puberty, she should be explained about breast health.
When it comes to cancer, it is a neglected thing.
Understanding the complexity of the disease, developing innovative therapies that changes the curve of patient survival, but also we're equally interested in removing barriers and joining with the medical and scientific and public societies to raise the awareness.
It is really important for a clinician to understand the tumor makeup to deliver, to offer the right treatment for the right patient.
The diagnosis of breast cancer is usually a huge shock for patients. Now, patients undergo an emotional roller coaster with worries about the course of the treatment, how they will cope physically and financially, and uncertainty about the time they have left. Now, improved treatments for early breast cancer have led to a significant increase in overall survival. So, how much does this improve the quality of life of patients? Are care centers able to give counseling to address the fears of breast cancer patients? How do caregivers support patients? Is the social stigma of breast cancer fading away? These are some of the issues that we will discuss during the show today. So please welcome our esteemed panelists who are joining us today. We have Professor Anand Mishra, Head of Department, Endocrine and Breast Diseases, KGMU Lucknow. We have Ms. Rekha Gulabani, Director, Jagriti Indian Cancer Society, and she's a breast cancer survivor herself. We have Ms. Neerja Malik, Global Cancer Ambassador. She's a cancer survivor. She's an inspirational speaker and breast cancer survivor. And we have Ms. Christina Wadhwani, Director, Healthcare Systems, Novartis. We'll also be joined very shortly by Dr. Govind, Babu, Medical Oncologist at Bengaluru. A warm welcome to all of you. Thank you so much for joining us. I want to take it to our cancer warriors first and understand from them, what was it like to first be told that you have breast cancer, and how did you react? How did you plan your life around it? Rekha ma'am, let me start with you. When were you given the cancer diagnosis? Because you're an inspiration for everyone. It's been years since your diagnosis, and you're still with us talking about it.
Thank you so much.
Actually, it was in 1994 that I did feel that I might be having breast cancer, but I ignored it. One thing, I was almost nearing 50. I thought I have lived my life. Secondly, I felt cancer means death. And thirdly, I never wanted to trouble my family by informing such a news to them. So I kept this to myself for 3 years. In 97, after my menopause, things became very bad. I was quite at an advanced stage. Not at the third stage, I was at stage 2B. Then we got panic, went to the hospital in the night itself. The doctor said, I know it is cancer, but FNSC must be done after tests. I should confirm. So after test, it was confirmed. I was not shocked, but I was very sad and upset because I never wanted to tell people, and then I didn't want to trouble people. I wanted to die very quietly. I didn't want to go through the treatment. Then the doctor told me, if you don't go through the treatment, you will live for 1 year. And even if you go through the treatment, you wouldn't live for more than 3 to 4 years. Now it is more than 23 years, I'm still living. I'm going to be 74 very soon. And, but at that point of time, I thought, if I have to die, how would it make a difference whether I live for 1 year or 4 years? So let me die quietly. Then the doctor gave me the horrible picture of death of a cancer patient. It would be very painful. If this lump bursts, it will foul smell and all that. I wouldn't be able to run away from my body. Nobody would like to live near me, and it will be very, very painful. So to die very clean in a hygienic condition, painless in a comfortable condition should be my aim. And so my family convinced me for treatment, and the doctors were real angels. They were very, very sympathetic with me. They treated me very well with full respect, dignity, and I'm very happy. And my operation was successful. And after my operation, the doctors became hopeful. They said, 6 chemos were already given. So after the operation, the doctor said, now we are very hopeful because cancer has not spread anywhere else. It has just locally little advanced. So after a few months, I told myself, one day one has to go. Do we die every day thinking that so why should I think now? When I have to die, I have to die. So then I stopped bothering about it. Say after a month or so, then I try to keep myself positive and happy. As it is, I can't remain sad for a long time because it's very tiring to remain sad and upset. So I have to be happy very soon. So whatever happens, I can't remain sad and upset, So that is God's grace. Thank you so much, Iman.
This is truly very inspiring for everyone that being happy is very important. But one small question, Rekha ma'am. Did you tell anyone when you first saw the lump? Did you tell anyone, your best friend, your mom, or anyone?
No.
Did you tell anyone?
No, not to anyone. It was only when it became very big, I told my husband. So he immediately took me to hospital. So he broke the news to others. I never broke it because I never wanted to upset anyone. But to tell you the truth, now I think if I look back, it has been a blessing in disguise. I was a very happy-go-lucky person, enjoying myself. Now I became very compassionate when I used to see other patients having financial problems. Some people, ladies having young children, So if I die, wouldn't bother, means it wouldn't affect people, But if a woman who has got a 3-year-old child, 5-year-old child, if something goes wrong with her, and then some people, they want to look after their wives or the women of the family, but they cannot afford financially. So I used to cry for them and not for myself. And then my husband told me, you pray to God, if you get all right, you try to help them. And that is what I did because I came to Indian Cancer Society, and through them, I started helping people emotionally. Then I realized I need much more. Then I wrote a resource directory, writing information about from where to get bras, prostheses, wigs, and diagnosis, and where to stay on a cheaper rate, 50 rupees per night, 100, where to get cheaper food, where can they go for financial help. Then I studied about the government schemes and the people who give donations. So gradually I started writing all that information because they don't only need emotional support, they need other needs also. If we tell them, "Bhai, ilaj kara lo, theek ho jayega," तो पैसे कहाँ से आएंगे? It is such an expensive thing. So I try to means know about the sources from where they can get funds. And so now then I work because of credit goes to Novartis, that I was allowed to go to Thailand to attend the Advanced Breast Cancer Advisory Board meeting. I learned a lot. They also helped me to do survey of around 100 women, metastatic breast cancer women. Then I wrote about the issues of metastatic breast cancer women, and I try to do as much within my capability to help metastatic breast cancer patients. I'm also a member of Global ABC Alliance, and I am still working on metastatic breast cancer. We have got a project in Mathura and in Noor, where we go to small villages, far off places, and explain the women about cervical cancer, breast cancer, and their screening, and then coax them to go to the hospital for treatment. And that gives me a lot of satisfaction when I'm able to take those women at the early stage to go to the hospital and get their treatment started. And then I have give emotional support, and I am able to get them funds from somewhere. So I think God has been great to me. Thank you.
This is amazing, ma'am. Not only is your story inspirational, you're also doing amazing work in creating awareness about this very critical disease of breast cancer. And this is our initiative, our effort as well, that everybody talks about this so that the stigma goes away, people know about it, and they catch it early. They don't hesitate like you did 20 years ago. They get treatment right away. Dr. Govind Babu is also with us. Dr. Babu, ma'am had a personal reason. Rekha ma'am didn't want to go and get a diagnosis. But what role does the medical community have to remove the fear, or maybe not the stigma, but just the fear of, oh, I'm going to die. Breast cancer is a death sentence. Because a number of times we've heard that when doctors give the diagnosis to patients, like you have 2 months, you have 6 months, sometimes it will just break a patient. So what role does the medical community have to, give breast cancer patients hope and the power and the will to fight?
Yeah, Anisha, I think the recurring theme has been that women in India put everything else ahead of them. They come to the last. So I think that is the recurring theme that is happening all across India. And this has to do with the positive thing in our society. But women should realize that, to take care of the rest of the family, they have to be good. They have to be healthy. Only then they can take care of the rest of the family. It's not that, that you fall sick and you become a burden to the others. They should realize that they're an integral part of the whole family. And, you need to work together to help each other. So women should not put themselves behind, because they, according to me, are the leaders in the family, not the men. So if a leader is healthy, only then the family can be healthy. That's how I see it. So as you said, awareness is not there. Even if it is there, they want to go much later to the doctors. This is with the people who are getting the disease. But one important thing I must tell you is even the doctors at the primary care level are not fully trained to handle oncology or make an early diagnosis. So in this direction, through our society, we've been doing programs for the primary care physicians. We covered about 10,000 doctors across India, just to tell them about how to detect cancer early. If you detect cancer early, it is potentially curable. So it is not just the patient's fault, it is also with the health system, because cancer as a disease has a very low priority with the government, with the health system. But things are changing now, and there is a proposal to have early detection.
All right. Dr. Mishra, Dr. Govind Babu has said something which is important, that women must not place their health behind everything else in the family and not make themselves the last priority. But and that they are working with general practitioners, physicians all over the country, so that early diagnosis is made, along with the technical know-how on how to diagnose breast cancer early, what about empathy? What about how to break the news to the patient? It's nice that a physician is able to tell that I suspect this could be breast cancer, so get it checked. But how about putting that line? These days breast cancer if found early is very curable. Do they have the empathy as well to break the news? Because sometimes when that is missing, the patient is so scared that they don't want to take the treatment. They just run away. And we've heard this from a patient. That's why I'm asking.
So it's very difficult for us also when we are telling the patients and start discussing. One has to be very empathetic. One has to be very respectful, in a dignified manner. Then we have to always identify who are the, stakeholders in the family with the patient, and then we should start discussing. And then there are many words, many phrases there are in the market. Cancer hai, गांठ hai, tumor hai, cyst hai. Patient बहुत तरह की चीजें, they have lot of knowledge from the social media and internet and Google when they come to us, and they don't understand most of the time the exact meaning of these symptoms. But in the back of the mind, they know something wrong is there. They are expecting something wrong news. So that's the way. But when I start talking with the patient, or what I tell my residents to talk with the patients, they should be very soft. And then one thing I notice in Rekha ma'am's narrative, that the doctor has said that you are going to die in 1 year. हम कोई ज्योतिषी नहीं है. I always tell my patient, and always when they ask हम कितने दिन रहेंगे, या उनके parents आते हैं, family members आते हैं, सर कितने दिन जिंदा रहेगी. So we are not Jyotishi. We work on evidence-based medicine, and evidence-based medicine is based on the experience, on the treatment stages and everything. And you can just notice from Rekha ma'am's experience that doctor has told if you will live with the treatment only 3 years, and that's a bad thing. You tell the plan of the treatment, you discuss the treatment formalities, you can discuss the side effects of the treatment, all those things. But don't go directly on the outcome. Outcome should be once patient has developed a complete confidence, he has understood the disease, he has understood the treatment, different types of treatment options, and then only we should go on the outcome. I usually don't like to tell the outcome on the beginning. Even if I am expecting the outcome, that this patient will behave good or bad. So that's the way I put it. One should be very, you're totally right. One should be very empathetic, and we should tell all these things in very dignified manner.
All right. Neerja ma'am is with us.
Govind Babu again. What Dr. Anand says is entirely true. We need to individualize each patient. How I tell them is, first I talk to the relatives, because I need to find out what is the frame of the mind of the patient, how much he can take, what background he has got. So I first talk to the relatives, find out all that, and only then decide how much I should tell. And I don't tell the whole thing at the first sitting. I tell them there is something wrong. I need some tests to be done. I will see those reports and then tell you. And as Dr. Anand said, definitely we are not astrologers. We can never say how long each person is going to live. So I will tell them I will do the best for you. And ultimately, let us see how the outcome is going to be.
But as stated in the, medical terms, doctors are supposed to tell the patient the truth, If you go technically by the word of the book, So he went by the word of the book, and then they are supposed to say if these are the circumstances, these are the results, then of course this was the result. And it was 23, 24 years back. Things were not so bright at that point of time,
Correct.
Now the things have changed a lot.
So the truth, we always have to tell the truth, but the truth can be told in nice way. It doesn't have to be blunt. It doesn't have to hurt the patient. It doesn't have to give wrong impression to the patient. That's how I see it.
And the timing of it as well.
Absolutely.
You choose the timing to tell the patient.
Absolutely.
I was quite aware because I knew the things, and maybe that's why. And they have been very kind to explain to me. That's why I went through the treatment. Otherwise, I wouldn't have gone through the treatment. I have learned a lot during so many years. I have got lymphedema. I didn't know how to protect it, but now I tell other women, I go to hospital, tell them about the prevention of lymphedema. So many people, they don't get this lymphedema. Then we go to village, talk from door to women, because we are talking on a virtual platform. So where are those women from Juggis? They are not here on this virtual seminars. So we have to go to them, not done. These days for last 1.5 years, we haven't gone. But then we used to go to Vrindavan, to every village, talk to women and see to it that a women from every family comes to us. And we used to sit in the chopal and talk to them, because we should make aware those people. Educated people are still little aware. So we should rather go to the root lab. So
and that is very commendable, Rekha ma'am. And we hope that this platform will reach every nook and corner of our country, and more and more people will be able to understand the different aspects of this disease. Neerja ma'am, you're also a survivor, and you also inspire people with your story. Now, for the time that Rekha ma'am was diagnosed to now, things are very different. First of all, we have a lot of advancements in treatment, and if detected early, cure rate is very high, like Dr. Govind Babu told us. But also, now we see many younger women being diagnosed with cancer. In our country, it's very different from what it is like in Western countries. And these younger women may have higher responsibilities. And so the emotional load on them may be very high. How does one deal with the news that you have cancer? Should we look at the positivity of medical advancements and better chances, or should we see, oh, my responsibilities, my children, what I wanted to do, my dreams? How does one, motivate themselves?
Thank you everyone for being here, and this is a wonderful platform where we can discuss things. So first of all, Anisha, I will tell you that I've gone through breast cancer twice. So the first time it was in 1998, and the second time it was in 2004. And I can tell you right away that there was immense difference if you're talking about the medical aspect, the science aspect. In 98, there was what was called a surgery. So a big tumor was removed from my breast. There was a bigger tumor in the armpit. And if you touch my armpit now, the left one, it's like a well. Now, let's fast forward to 2004. There wasn't just an ordinary surgery. It was a microsurgery. So even though they took out 38 nodes from my right armpit, as opposed to 21 from the left, and thankfully none of them were, malignant in the right. There were 9 nodes malignant in the left, but you cannot make out. So advancement in surgery. Now, let me tell you that as far as oncology was concerned, I puked like crazy in 98. I was like continuously vomiting, and to the extent that I vomited a big fat worm. And my husband was there, and he actually caught it and kept it. I said, "What are you doing?" He said, "Going to show it to the doctor." And I told him, I said, "Mandeep, if I had told you that I vomited such a big fat worm, would you have believed me?" He said, "No, never." So all kinds of crazy things happened, and I was miserable. Guess what? In 2004, the medication was the same. What was the difference? The difference was in pre-med and post-med. Instead of Amiset, I was having Granny-Set. So I promptly said, ye Amiset ki nani hai. Isliye it's better. I didn't puke even once. Okay, difference between 98 and 2004. Talk about radiation. We just had cobalt. Now you can go shopping. It is targeted. It is this, that, and the other. Your heart and your lungs don't get affected if you are having it straight through. So advantages are many in science and as far as medication is concerned. But what about the human aspect? So the first thing is, I do not call myself a warrior, a survivor. I call myself a conqueror. Because to reach a certain space, you have to conquer hum honge kamyab. You know, I ran to my father, Anisha, I am going to take a little longer because I need to get this to the hearts of the women who may be diagnosed, have been diagnosed, and how they are doing it. Now, why can I know that when I talk, it affects them? Because the ace up my sleeve is been there, done that, breast cancer twice. And if I can do it, so can you. So the empathy, the love, the affection just pours out of me. And when they speak to me, sometimes they are dragged to talk to me and they resist. They just want to curl up and die. And then I start talking. And from this, their demeanor changes. And by the time I finished, they want to quickly finish their treatment because I've told them, come and join me. I need you to inspire the other cancer patients. Now, you were talking about young women, and you were also talking about how they deal with it. But let's go back a step. Do you know what one young woman felt when she came with her 4-year-old son and a 6-month baby? She refused to touch the baby, the son, and the husband. She only allowed her parents to touch her. Why? Because she thought that if she touches the other 3, she will pass on the disease to them. So when we talk about awareness, it's not only the stigma that will anyone marry my children after they get to know that I've got cancer, but it's also about the fact that it's not contagious. It's not infectious. It's something that is happening within your body. And if you could just break up everything in very simple, endearing, loving, and understanding tones, then we would go a long way. And let me tell you something. The Department of State US had called me for a 21-day trip to all the hospitals in 6 cities. And when I asked them, I said, okay, great. You have a patient navigator, you have a social worker, you have, etc., liaison officer. What happens after hours? And you know what they said, Anisha? They said 1,800. And I said, do you know what after hours is in India? With me, I am the patient navigator. I am the social worker. I am the liaison officer between the doctors and the patients, and I am 1,800 because my patients have this knowledge that they can get in touch with me 24/7. And I will hold their hand and take them through the entire treatment of diagnosis, blah, blah, chemo, surgery, radiation. So I think what every hospital needs, especially a cancer hospital, is a counselor. And if I could, I would clone myself into many millions so that I would sit everywhere and talk with a loving heart to each and every patient. Does that answer any of your questions?
Thank you, Neerja ma'am. The work you're doing is amazing. And I'm sure you give a lot of hope to women who come with breast cancer. Christina is also with us, and Christina is, I'm sure, Christina, a lot of this resonates with you too. Now, we're talking about breast cancer awareness. How do drug companies support women and the caregivers when they've been diagnosed with breast cancer? Now, drug companies do have a role as to put in the hours of research and come up with the best that medicine can offer. But what about emotional support? Do drug companies have any role to play?
Absolutely. No, thank you for that question. And firstly, I just want to thank the esteemed panel. Whenever I hear Miss Rekha speak, every time, she is quite an inspiration. And I remember I met you 2 years ago when we were talking about collaboration in India for breast cancer patients. And after leaving her room, I just cried because I was also just diagnosed that year with breast cancer. I was 33. But I saw what there's a life beyond that diagnosis. Of course, if you catch it early, if you treat it early, then you can be a force for change and inspire a whole generation of women behind you. So for both Miss Neerja and Miss Rekha, thank you for everything you do. To go back to your question, Anisha, so I think, pharmaceutical companies and private sector companies are in a very unique role and have the power to do two things. One, there's a power of course, influence through treatment. So, and not just Novartis, right? There's many different pharmaceutical companies. We have other industry partners that there, there's teams where their jobs are, yes, to develop the most cutting edge innovation and technology and therapies, targeted therapies, specific mutation therapies. So I think in one way there's that influence. I think in a second way, we have the ability where we can take some risk. So specifically, you were mentioning, how can we work with patients or patient groups? I think that's an extremely important link that I would like to think that Novartis, specifically our colleagues in India and other companies as well, are really looking to strengthen and elevate those patient voices. It's one thing to develop a drug and put it on the market, try to get reimbursement for it. It's another thing to provide kind of the information for patients so that they know how to navigate their treatment options, how to navigate the healthcare system. And so I think, there's some great examples that we're doing with Japaigo, and I know there's different professors that we're working with in India to look at how do we decentralize healthcare for patients. Just because you're screened and then you're diagnosed, that's great. But then if you're told that you have to travel to, miles to a referral center for confirmation, or once you're confirmed, you then have to travel into the city or super far away to get chemotherapy or to even initiate therapy. And now we have other options. We have targeted therapy, there's radiation. How do we get patients to that treatment? And I think we are trying as best as we can. We could always do better, but to work with patient groups, like the National Cancer Societies of India, other community groups, other patient groups, to help build that mapping. So depending on where a woman lives, whether it's a rural or regional or urban area, where's her nearest screening facility? Where's her nearest confirmation of diagnosis facility? And if she, how do we make sure that she knows her different treatment options? How do we work with the different states of India? How do we work with the different governments of India to get this information out there, to help them navigate through the healthcare system? Once they're referred to diagnosis, how do we get them there? Once they're referred to initiate treatment, how do we get them there? And that's not all. A lot of women, maybe they don't adhere to their therapies. I had to take tamoxifen for 2 years. There were some mornings where I forgot to take tamoxifen. Super dangerous if you don't want the cancer to come back, if you don't want the cancer to recur. So how do we maybe work with not just facilities, but can we look at sending reminders or developing digital health tracking tools or communication tools where we can constantly remind women, to live with their disease and adapting to the life with it. And I think also, just hearing from our panelists, there are leaders. What works? What do you feel works for your women? What works for your patient? What should we, as a pharmaceutical company, be doing more of? So this is where I think it's bi-directional. It's not just us saying, "Oh, we have a good idea. Let's do this program." We absolutely need these best practices from our experts.
But the mapping idea is a great one, Christina.
I would like to stress one point over here. We always try to look after the patient who have already got cancer. And if they have got cancer, we only talk about that moment, treatment, radiation, chemotherapy, and all that. What about the effects that the woman has later on when the treatment is over? So I think we should educate women that before going for treatment, they should first discuss their fertility issues, their sexual problems issues, their physical ability issues, their cognitive issues. These may have after effects, which most of the people are not aware of. If we are able to educate women to know, understand, and deal with them beforehand, fertility issue has to be dealt with before the treatment starts. So how many people tell those young patients that you may not conceive even means after the treatment? Then she will be shocked that I had cancer, I'm not able to conceive also. So she should be told that there are methods, to preserve their ova and use it later on, and their sexual dysfunction which may happen to them and how to cope with that. All these things should be discussed with the women especially who are young. We are old, so we already had our life. But what about those women who are in their 20s and 30s? We should educate them about the long-term impact of cancer treatment and how to deal with them, which is, I think, is a very important part of it. Thank you.
Right. Dr.
I'd like
Babu?
to say, Anisha, sorry, 1 minute. So last year, we're talking about breast cancer awareness, and we are also talking about catching people and letting them know about it. Last year, this very month, I ran a campaign on Facebook and various other social media places where every woman took a pledge that I will pass along information about breast cancer awareness to at least 10 more people. Now, what information do they pass? So on my social media YouTube channel, there is a 4-minute video on self-breast examination. And this can be passed along on WhatsApp. So this is what I did. We got women to come out of their comfort zone to actually take pledges. And then with thanks to WhatsApp, it's not just 10 people. You just send WhatsApp of this self-breast examination to 10, 20, 40, and it spreads. So I must say it was a very, very effective and successful campaign in spreading the knowledge to aunts and I said even the boys, please join in, because you have mothers, aunts, sisters, wives, daughters. So it went off very well. But if this could be done, and I told people, I said, don't just stick to October. Spreading of awareness should be a year-long thing. So maybe that's why companies like Novartis and all that could come forward and keep these projects ongoing instead of just restricting them to the month of October, pink ribbon.
Yeah.
But we should also tell even men get breast cancer.
Exactly.
Yes.
They should also be aware of their breast.
Yes, we've done shows on this also. Dr. Babu, awareness is very important. And Christina spoke about, mapping, creating a map for patients so that navigation is easy. Now, I want to understand from you in your hospital, how does this mapping happen? Is this mapping happening?
Yeah, first, let me really congratulate Mrs. Neerja and Rekha. You're doing wonderful work. And, I really use the patients who have finished treatment to talk to the next patient who comes. And that is the most effective way. And a lot of my patients are willing to do it because they believe that they have to give something back to the society. So I make use of them. And that is the best way, believe me, because whatever I tell my patient, she is not going to be convinced unless, like Mrs. Neerja said, she has gone through it. That is when they will be convinced. So that is a wonderful thing you're doing. The second point about self-breast examination. There are enough studies today to show that it is the most cost-effective method of detecting breast cancer early for a country like India with low socioeconomic status, and we don't have mammograms everywhere. So this is the most effective way. So I think this is one very, very, very important message that has to go to all women and men also. So I think that will really make the detection much earlier. So that is important. Right. Coming back to my hospital, incidentally, we have what is called a psycho-oncology as a part of a multidisciplinary team. And incidentally, today was 30 years of starting this department. So we just had a celebration for that today. And we got a lot of our patients to talk. And this has really made a lot of difference for our patients. People who didn't want to take treatment have taken treatment, and now they have started counseling. And like Mrs. Neerja said, the thing about vomiting, the hair loss, everything, if we really sit and counsel them, they will definitely take. And to tell you frankly, as doctors, we are really not totally trained for that because our area of expertise is something else. So having a psycho-oncologist in your MDT makes a lot of difference. I must tell you that. So that is how we treat our patients. So in fact, before we decide on even making a diagnosis where we suspect strongly, the first consultation is with a psycho-oncologist, and then everything else happens.
This is a great effort, so that for patients, the landing is a soft landing. Even before the diagnosis, they're prepared.
Absolutely.
Dr. Mishra, okay, Christina, you want to say something?
Sure, if I can just to respond to Dr. Babu, I think about when I was diagnosed 2 years ago, and I was very lucky to be diagnosed within the Swiss healthcare system. So I understand that, there's many situations where this doesn't, it doesn't apply. But I was very lucky to be offered therapy, and I didn't take it. My oncologist said, you might want to talk to somebody through this, because you're right, my ovarian production was depleted because of the cancer and the therapy. I did freeze eggs, but I only froze 2 because I wasn't producing. Even they were pumping hormones in me, but I wasn't responding. And if I could go back, I would have taken that therapy. I would have taken some mental health counseling, because now I'm married and we don't know if we can try. Even if with the 2 eggs, we don't know the viability, because you still have to test. There's so many uncertainties. But I remember in that moment, I was just like, I just need to survive. So I don't care. Let me get on treatment. And I've survived, knock on wood, for a very long time. But now it's family planning. And what this burden, there's this mental health load that I'm bringing to my husband every day. And it's not fair for him. So I think it's also, how do we take care of patients? And of course, the caregivers, people who are orbiting patients' lives. Breast cancer doesn't just impact the patient. There's a community that also gets impacted. So I appreciate that comment.
Absolutely right, Christina. So we must take care of the caregivers as well as of the patient. Very, very, very important. And the part of the preserving the ova, the sperms or whatever, very, very important. I just had a patient yesterday. He's a male who's got lymphoma, so he's potentially curable. But the first thing I had to discuss was this, because he came and said, I'm engaged, I'm due to get married in December, what should I tell? So I think that is very, very important. So I said, this is the priority first. Treatment for lymphoma can wait another 2-3 days, but let's sort this out first. So that's what I've done.
One more thing, I need to really bring this to the notice. I'm glad that we're discussing all these things so openly. What about women like me, for instance, who tried and tried again and again to have a child? So I had a lot of trouble. I had a lot of premature miscarriages. And I promise you, I had a lot of Clomid and all kinds of medication pumped into me. But yeah, in spite of many miscarriages, a stillborn in the 8th month, I finally have children who are twins. But guess what? The gynecologist doesn't say. I think, considering this is such a fantastic platform where we're discussing the pros and the cons, a gynecologist should also convey to a patient like me that, listen, I know you need or you want to have a family. And I had my twins when I was 36. But what no one tells you is that, you know what? Just be a little careful. It's your choice. That if all the Clomid and all the hormones and all the things that are getting into you, if this may lead to cancer. I've never said this before, but it never occurred to me. So this
and
is
I think, ma'am, perhaps more studies will also be needed to be done to get a direct link between, the impact of fertility drugs taken on whether a recurrence of cancer happens or not. I guess more studies will be required then.
Actually, what Neerja said has actually happened with me, because I got married at the age of 42 and had a miscarriage, and then I could never conceive. And I was desperately trying to get the treatment to conceive, And then at this stage, when I was 44, the doctor told me, you may not get the baby, but you may get breast cancer because they are giving you all types of hormones. So you are too old, so forget about the baby, So then I stopped that treatment. But I think doctors, even when I was 42, I was quite of age, the doctor should have explained to me that this is not the right age to try.
Okay, so let's ask the doctors whether there is a proven link between this. Dr. Mishra, is there any proven link? Because as much as I know, there is no proven link yet that fertility drugs could lead to an increased risk of breast cancer. The studies are not conclusive. So what would you like to say?
There is no yet evidence for this, that fertility drugs causes breast cancer. There is evidence, enough evidence that estrogen contraceptives having both estrogen and progesterone, they can be responsible for breast cancer in some patients, but fertility drugs, no, till date.
Right. Dr. Mishra, do you think we have come to a place where we have a patient-centric approach when it comes to treatment of breast cancer? Have we reached there yet across public and private hospitals?
Yeah, definitely. We are trying to do, I mean, if you see the problems with the big government universities or big public hospitals, that we have lot of patients, and high number of patients in the OPD we have to cater. And but then we have residents and team. Individually, one resident is looking after one patient, he takes history examination, and then that patient comes to me. Another senior resident, senior to him, is taking care of the follow-up patients. That way we try to manage and try to give adequate time to all these patients. But sometimes I will accept that sometimes we are not giving adequate time to these patients, but then they can always have the opportunity, they have always an opportunity to come back or meet me in the office. We are open to that. I'm not so, as a department, we are not so, very hard on these, that you cannot meet, you meet me on the office time or in the OPD time. As a department, we have been making the things smooth for the patients. We have created a Lucknow breast cancer support group. We were talking regarding the patient navigator, Dr. Neerja and Neerja ma'am and Rekha ma'am was telling. So we also have created a Lucknow breast cancer support group. It's a big support group, more than 100 survivors patients. And I have a diary in front of me when I'm sitting in the OPD. And we use those, the patients, survivors who have volunteered that they can guide new patients. So whenever I'm looking after the patient, I will just ask them, would you like to talk to any patient who has been cured from this department? And if they are willing, so I just note down the name and number of that patient and inform that survivor that you have been allotted a patient. That's the way we have been doing for last 1.5 years. And it has been working very good. In between a monthly, we have a meeting of first Wednesday, we have a support group meeting, and I usually try to take what happened to that patient, what were the questions, I tried to ask them what were the questions, what were their concerns, and what answers you have given. Now, I tell all my survivors that you need not to tell about the outcome of the patient. You need not to tell or take a decision regarding the chemotherapies. You should not take a decision or give them an answer of the type of surgery. You should only give them the confidence. You should inspire them. And then you should tell them that they should complete the treatment, whatever difficulties they are getting. Inform me the difficulties. You inspire them to complete the treatment. And then you can help them all other financial things, social things, how you have progressed, what financial you have, what government schemes you have, if you are aware, those all things I tell them. But regarding the disease things, I restrict them that you should not discuss those all things. So that's the way
that's the domain of the doctor, and the doctor should be.
No wonder Dr. Anand Mishra is so very popular amongst his patients. I keep hearing about him. He's very popular among his patients. Nice to meet.
Yeah, and they have a good system in place so that the patient also gets confidence. Christina, you said that you were in the Swiss healthcare system and you were diagnosed with breast cancer. You also spoke about working with different state governments in our country. So, since you have been working on, breast cancer policy shaping around the world for so many years, how do you place the Indian healthcare system versus what you're seeing in other countries?
Sure. I think what has been very eye-opening in India is the willingness to try new things and to innovate. When we together with Japago launched a program in Madhya Pradesh around strengthening the continuum of care for patients who have breast cancer, and exactly, trying to map out where they can go next and making sure that they're not lost. And we launched this during COVID, so it was a very also not an ideal time to launch a non-COVID program in healthcare with any government, not just with India. But I think from a policy perspective, the willingness to kind of redistribute healthcare staff. So the state of India allowed us to activate ASHA workers and kind of not repurpose their role, but in addition to ASHA workers' role, start kind of being that community experts, go into the community and spread awareness about breast cancer and the risk factors for breast cancer, and then help women go to screening facilities, help take them physically to screening facilities and get them screened and confirm diagnosis. We've been trying, I work for Novartis in oncology here in Switzerland, but I cover Asia Pacific and Middle East. We've been trying to do these models in other countries, and we couldn't be able to. Mostly, yes, of course, there's a funding issue, but from a policy perspective, we were told many times from multiple different countries, breast cancer is not my priority right now, I'm sorry. Or, I'm sorry, yes, we know women are being undetected, and that increases the chance of metastasis, decreases their overall survival, but you know what? We have COVID, so sorry. So we've had the door shut on us in many different countries. India was not one of them. And even in addition, there were moments where, the state of India was very open to say, hey, we're doing a training on how to care for COVID patients. Add on how to care for COVID patients while they have breast cancer. Do 2 in 1. And that is something that we've been trying to replicate in other countries, and we just haven't been able to. So I think from both a mindset and a policy perspective, there's definitely opportunity. I think India is one of the countries where we're learning so much, and we have such positive reception from policymakers. While with that being said, we know in other markets like in Egypt and other Asia Pacific countries, we're in the process of kind of updating breast cancer policy and breast cancer guidelines. But updating those guidelines takes time. So what I really admire with India right now is while we're waiting for updating, we're not afraid to test new models, and we're not afraid to redistribute. And yes, caring for COVID is a priority, but that doesn't mean women should die from not getting screened and not getting treated. So yes, in time. So
that's great. The fact that in India, innovation is possible, and now we have the National Digital Health Mission. With technology and innovation, a lot is happening. We've seen it with COVID. We've managed to innovate on drugs, create drugs indigenously in India. We've managed to still, do good tracing in COVID. So a lot of things are possible. And it's very heartening that at least we have not said that this is not on our priority list. It is priority. Our women are priority. Neerja ma'am, you spoke of a campaign that you have on YouTube. You said that I have a video in breast self-examination. We can send to so many people. But who does it? Do you think Neerja ma'am spoke about this video? Now, do you think we need something more? Not just what we are talking about is actually living through and after your cancer treatment. But just one question I want to get Neerja ma'am and Rekha ma'am in. You're survivors, but you're warriors, you're conquerors. But for those who don't have the disease, or for those who should try to catch it early, do you think we need a buddy system? It's nice to have a video coming to you, but you get so many videos, and who's going to watch it? Who's going to sit and do this? Like, I call up my friend every month and ask, have you done the breast exam? She calls me every month, at the right time and asks me, have you done your breast exam? We need to build a community between friends. We need, physical and human reminders. Do you think something like this can be done with people you work with? Rekha ma'am, you go first.
Actually, I have belonged to Indian Cancer Society. I'm Director Awareness and Breast Cancer over there. And we have developed an means app which you can download on your Android phone. And on that app, we have explained about breast cancer and cervical cancer in a very simple language, Hindi and English both. So if one has that app on the phone, so we try to ask people to have that app on their phone and then see to it whenever they have time, and then they can know about the symptoms, treatment, all these things, and breast self-examination, about cervical cancer and all that. And we also discuss with others, though it's a little away the point. Once we had a meeting with the health minister at that time, Dr. Harshvardhan, we were talking about Ayushman Bharat. So if they develop a rule or a scheme for the help of the patients, but they say the patient has to be indoor patient. Now, chemotherapy patient doesn't have to be indoor patient. And chemo is the most expensive part of it, So I asked to the minister, Saab, you should give it even to the outpatient also, and you should see the need of the time. Cancer is such a disease, you get admitted only for the operation and not for chemotherapy. And then they don't get money from Ayushman Bharat from that, And second thing, what I feel is we should try to contact all startup society, right from the villagers to the urban, to the Juggi Jhopdi, to the higher class, celebrities or whatever, because every human being is important. So we should try to reach out to all. That is why we go to villages. We have taken up Mathura Vrindavan, we have taken up Nu, where we go to each small village and make a list of how many women are there, how many women have listened to us, how many have been screened, and if they are screened, have they gone to the hospital? So one by one, we take up the villages and go to them. And I also pleaded with the Minister Saab that you should have campaign against cervical cancer, because this is the only preventable cancer. Then we could fight.
Cervical cancer is going down actually.
We have fought polio, smallpox, everything is gone. Cervical cancer can also be eliminated completely if the government makes a policy and a big campaign. Like if we go and talk, nobody would listen to us. If Amitabh Bachchan comes, only then they would listen to us.
It's not the government, it's the influencer there.
So I try to do it. Once or twice I went to the media channels also, like Lok Sabha, CNN, IBN. And I have always stressed the point that why don't media people take it out, program kare iske upar and make some celebrity talk about it. So this is 100% preventable, So why not eliminate?
So we have indigenous technology developed by Tata Cancer Hospital also, where a lot of work is being done to detect cervical cancer early. And actually, this is one cancer which is going down in our country. And that's a heartening thing. Neerja ma'am, to you. So do we need individualized, personalized reminders? And we need to talk about this.
But you are very right. So I must tell you, this reminded me of what I used to do. So let's call them booby buddies. I love your word, the buddies. And what I used to do is, I used to take all my friends, personally fix up appointments, because I made the Apollo Cancer Hospital say that in the month of March and in the month of October, please give a 50% discount on mammograms. Okay, so I would take these gangs of friends. First, I would fix up appointments for them, and they would en masse get their mammograms and tests done. And let me tell you, quite a few were detected. Secondly, my dear friend Khushbu, when she turned 35, she called me up and she said, I want to gift myself something. I said, what? And she said, I want to gift myself a mammogram. And now wherever I go, I always mention this. And every 2 or 3 years, she gets a mammogram done. And I promptly say Khushbu, because I know that people hear it and they get excited. Secondly, I must tell you, Anisha, that I'm part of something called India Turns Pink. Yes. It was by Anand Kumar, and it started as Chennai Turns Pink. And I told the man that he was going places because suddenly Goa was turning pink and this was turning pink and the other place, all of India. So I said, why don't you change your name from Chennai Turns Pink to India turns pink. Now, what do they do? This is fantastic what Anand has done. He has sworn that by 2030, we are going to try that India is breast cancer free. You know, you have a goal, you work towards it. So we give talks to all the colleges and all the universities and the schools, and from every university. Let's say I go to a particular college, I will pick up 50 girls who, and call them warriors. Okay, we call them warriors or angels or whatever, and teach these 50 girls self-breast examination. And then let them loose on all their friends, their aunts, their mothers. So apart from all the colleges and all the schools, the urban areas are taken care of. Now, the same thing in mobile vans goes into the villages. And of course, it's more difficult in the villages because they don't like the women to go out. They don't know what's happening in a closed van, etc., etc. But let me tell you, that awareness is spreading. It's going down to the grassroots, and everyone is doing whatever. And 2030, God willing, we shall be breast cancer free.
Even we.
And I have the advantage that I have is that I have done my graduation in social work. I've done my B.Ed. And so I have taught in schools, and I've also been a social worker in schools. So doing what I do comes not only with the passion and dedication, but also with the skill of casework, group work, community work.
Yes.
So I think if all of us could just delve in and spend some hours doing this kind of thing, it would be wonderful. I'm open to anyone wanting counseling from me day and night. Please take my number from Anisha and get in touch. I'm there.
We also motivate people by giving awareness talks, and then we make the screening free for women in the month of November because it's a cervical cancer month. So any woman and we try to bring women from different parts of Delhi NCR to come to our center and have free screening for them. And after that, we whenever we go for awareness talk, we pick up 2-3 women leaders from that locality and make sure that those women coax the other women to go do the breast self-examination, go for screening and all that. Of course, we don't encourage less than 40 women to go for mammogram. They should go for ultrasound.
That's right. Or self-breast exam. Yes. Right. Now, as part of our meaningful action and awareness to eradicate breast cancer from India, we feel that there is a need for a national pledge in the form of a public campaign to create awareness among the masses about breast cancer and taking appropriate and necessary actions to come out of it. Through this national pledge, we invite the government, responsible authorities, private organizations, educational institutions, cancer survivors, influencers, prominent personalities, and from various segments of our country to come forward and show solidarity and support the National Pledge campaign to build accessible infrastructure, information centers, and awareness on prevention, timely treatment to eradicate breast cancer from India. We wholeheartedly welcome Novartis for supporting this massive drive and have the privilege to have the support of Neerja ma'am, Rekha ma'am, Christina is here, from Dr. Mishra to help us create this awareness, and please do support this campaign. You can go to the website ihwcouncil.org and go to the link where we are. We have this pledge. Do sign this pledge, and we all will pledge our support to continue this national pledge campaign to fight breast cancer till the time we achieve 0 cases in India. So let's all pledge to make breast cancer mukt desh, that is Bharat breast cancer mukt. So this is what we would like, and the way we get there, we have survivors talk and inspire. We have advancements in medicine and technology outreach, so that people, women who are diagnosed early and are cured instead of just living with a fixed timeline. Because we have inspirational ladies with us who have actually lived to tell the tale. Now, Rekha ma'am,
yes.
There is one thing about the diagnosis, the shock, the getting over it. What happens in real life? you spoke about your problems you have in conceiving. Uh, what is it like when you have follow-ups and um, you know, do you fear recurrence? How does life change once your treatment is started? And what uh, are you? Is the fear that makes you go through the treatment? What makes you complete the entire course?
Yeah. Actually, after the treatment, most of the women, they always think that it would recur, It takes time to throw it out of your mind, So if any small thing, we always fear it is going to be cancer. I think for first 6-7 years, I also kept thinking, and I see the other women also kept thinking. But then we go to the hospital, talk to these women, and they see people like Neerja ji and me, then they feel confident. If they can come out of it at this age, why can't we come out of it? Because younger people have got more strength biologically to fight against any disease, And at the same time, we should prepare them about the scenario, what is going to happen after the treatment is over. I have got a group of around 100 women on WhatsApp, and we get together 2-3 times a year, and we share with each other. And the best part of it is I have got many metastatic breast cancer women, and they are more enthusiastic as compared to us. They keep waiting, Rekha ma'am, ek baar wo karo, fashion show karo, we want to walk the ramp, we want to dance, let us have kitty parties, let us go for a movie. And then they are so happy, they divert their mind and they say, we are very happy now because we are able to enjoy. And few of them coming from remote villages and such places who have never seen such life, so they feel much better about that. And secondly, we don't have to counsel them all the time. They counsel each other on their own also. And different women have different these things. But we have to tell them certain things are very natural after the treatment. Their cognitive issues, so many women feel strange. Why I am not able to be as active as I was before the treatment. It takes time. They do come to the normal space, but it takes little time. So where the cognitive issues are concerned, they are not able to concentrate for a few years, even the treatment is over. Then women by nature, if you have read the book, men are from Mars, women are from Venus. They say by nature, men can do only one job at a time, and women are multitasking. They will be working in the kitchen, getting their child ready, and giving medicine to the in-laws, and giving spectacles to the husband, and then talking to the maid also, and then getting ready herself for the job. They are multitasker. But after the treatment, it takes them a few years to become multitasker because they cannot concentrate or cope with so many things. So she wonders why I'm not able to do. So she feels something wrong with me. We have to explain that you are so weak after chemotherapy, radiotherapy. It will take you time to do all these jobs at one time. Sometimes there is loss of memory also. Sometimes you remember the things and the same thing you may forget the next time. So don't worry, all these things will get all right, And for them, you should play some games where you have to use your brain, mental exercise and all that, and then relax, listen to the music and do Zumba and all that, and that will refresh you and that will improve your memory thing, So that will, so that is also very good. And another thing is, like when I was out of it for 2-3 years, sometimes I used to repeat the sentence. I knew I was repeating, it is not good, but I couldn't control myself. So I would say one sentence again and again. Then my husband would say, okay, just keep quiet, talk after some time. You leave it here. Now it's fine. Now after 23-24 years, I'm perfectly okay, So these issues one should attend to, and they should give them time and space to come out of it. Don't make fun of them. Don't let them lose their self-confidence. And another thing is at the workplace, people should be empathetic rather, should not be sympathetic, empathetic. Give them their space, their time. Don't tax them. Don't stress them. And make them write something in diary because they are little forgetful. So every small thing they should keep writing. In case they forget, they refer back to the diary, and give them little more time to work. Don't give them small target time.
Right deadlines.
Deadline. So that I know. So this way, everybody should help them. The good thing is like doctors here are so good. A doctor treats the disease, but a good doctor treats the patient. So when you say patient, so it is a holistic treatment, physical, emotional, spiritual, and all that. And at the same time, I think it's so many women are not aware of so many things, like if they go for reconstruction, they don't know what type of reconstruction is there and what will be the repercussions for that. All these things should be explained to them, So, and then sexual issues are also there. Women become not interested in sex, or maybe very less interested due to their disease, due to the side effects of the treatment, and due to their body image. Because of the body, because they feel I have lost my femininity, they lose the confidence, and they doubt the love of their husband, and they feel he is sympathizing with her, not loving her anymore. No, so all these complex emotions are playing in her mind even after the treatment. So they should be given some space, some time, and there should be frank and open communication between the partners, and they should explain each other and be mentally ready to listen something which may not be very pleasant to listen to, and she should be told also that you may also have to listen something unpleasant, and your partner may also have to listen to something unpleasant, but try to understand each other from their point of view, give each other time, and explore some new methods to get pleasure, and in the beginning, a woman may not be interested in sex, but holding hand, hugging and kisses may give her a feeling of love, sense of belonging, sense of comfort, and being stress-free. So all these things will gradually lead her to the normal life. And then there are gynae problems like dryness in the vagina, then pain in the at the time of intercourse, or maybe dryness in the mouth also sometimes, So in the vagina dryness, she can use moisturizer, and she should consult the gynecologist from time to time. As doctors have said, we never suggest people about any medical things. We say, of course, this happens. You please ask your doctor what moisturizer you should use and how much time it should take and what methods you should explore, because I am not a doctor to tell you that. But we do tell them that these are the problems women do have, especially the younger women. And we guide them to go to the gynecologist. And I think nowadays things have improved. Even doctors tell them there are different methods of reconstruction, and they should be told what are the different methods and which is the best suited to her and what complications she would have. So if she doesn't get reconstruction done, there are bras and prostheses. Volunteers like Neerja ji and me, we tell the patient there are so many kinds of prostheses and pocketed bras that she may look very good and her body image will be intact. But if she opts for reconstructions, so we ask them to consult the doctor. There are 4 or 5 different methods of reconstructions. The doctors will be able to tell them. And we, the new patients, when they are young, we also guide them that if they want to have a baby after the treatment, they should tell the doctor so and get the consultation from them, So we should prepare the women before the treatment, during the treatment, after the treatment, So all these things must be paid attention. Thank you.
Yeah.
So, I just have, Anisha, one thing I would like to mention, please. Let's talk about a patient, and the patient doesn't have a leg because she had to have it amputated because of cancer. But she looks like she's just stepped out of the Vogue magazine because she wears, she's properly attired, hair done, everything. So she comes and she sits in front of me and she cries. She weeps. And exactly the same point that, I get pain here and I think it's come back. I get pain here and I think it's come back. I get pain here. Now, that was a moment when I was wondering how to deal with it. One thing that I must tell you, that a lot of the things that I've learned about how to help a patient help themselves is what I have gone through. So when, for instance, I was diagnosed, my twins were only 7. And I cried for 3 days till I, came to say that, okay, the doctor is just a human being. Did God come down and tell me, you're going to die? No. So I figured out everyone needs a goal. If you have a goal to work towards. Yes. So I told this lady, I said, listen to me. You know something, I'm so happy you've come today and not tomorrow, because I will not be here tomorrow. She said, why not? I said, because I went for a movie. I went for a movie, and when you go for a movie, you have coffee and you have popcorn, and popcorn fell. And when popcorn falls, you do this. And I turned down and I showed it to her. I said, do you see this lump? She said, yes. I said, I just discovered it 3 days back. So I'm very glad that you've come today, because I met you, because tomorrow morning I'm going to Bombay for a surgery. Now, if she was crying before, she broke down now, hearing about me. And she wept, and I said, what's the matter? So she said, how unfair. I said, oh, you're crying for me? She said, yes. So I said, okay, why? And then obviously she did a lot of study about me. You had broken bones, you had so many miscarriages, stillborn, premature cancer twice, one surgery in 2011. April, they found a tumor, they found another tumor. When they removed that tumor, that didn't heal from April to blah, blah. And she was devastated. Now, this is what I had to tell her. And it helps me tell this to every patient. I said, all right, you're crying for me? Yes. You think it's unfair for me? Yes. Am I crying for me? No. So then I told her one thing, which, by the way, occurred to me at that point. I used to have a huge table. I touched one point of the table and the other. And I said, I know of just two things that I'm certain of. One, I'm born. Two, I'm going to die. Now, with me, I've had so much happening to me. I have a Damocles sword over my head. In 2018, I had septicemia 3 times. I had 210 injections in my neck, in the jugular, because I'm not allowed to use my veins in my arms, and the veins in my feet from 2004 onwards have been used for extraction of blood and insertion of medication. So it was a tough thing. And this is what I told her. I said, see, if anything happens to me, and I think that this is the end of life, then I will, and I told her, I said, there's a beautiful phrase in Hindi, mar ke jeena. I said, from point where I'm born to point where I die, if every time something happens to me, and I think this is the end, I will be, and she was not an Indian. I said, I will be dying, living. And I don't want to die, live. Because one day I might cross the road. A lorry will come and hit me. And I won't even know I'm dead. So why should I bother about that? You won't believe it. She wiped her tears. 3 months later, she came with a very handsome young man. And I said, who's this? And she said, he's my fiance. We're getting married next month. I wanted you to meet him. So as I'm talking to patients, new ideas. Oh, self-pity. You know what? What does self-pity mean? You're digging your own grave. And when you're digging it, the mud is falling on you. You're pushing yourself further. And if Anjanaya and Hanuman are flying, and they say, oh, let me help Neerja. Is Neerja open to receive? Is she receptive? She doesn't even know that people or God is trying to help her. I'm so, committed to digging my own grave full of self-pity, drowning in it. So I talk to them like this. And this, I know, is a lesson they learn for life. There was a woman who couldn't find her vein. And I asked her, I said, who is your Ishtadevta? Call. Tell them. Do you think of him as a father? Yes. Well, if you think of your God as a father, then he treats you as a daughter. Complain to him, tell him, and you won't believe it. I hollered at the nurse, you can't find a vein because she poked it 8 times. I know how it is. I sent her away pretending to be angry. I held her hand. I said, you're so tense. Just think of the needle like a hot knife, and your vein is like butter, and the hot knife goes through the butter. just rest, just relax. And I did this sitting with her, called the nurse, and I said, see, nurse, be careful. And when I told her all this, I told her about the knife and the butter, and I told her about her God. Do you know what happened? The needle went in like this, and she wept, and she held my hand, and she kissed me 1,000,000 times. And she said, thank you. And I said, thank you? Thank you for what? I haven't done anything. Now, this is the point I want to make, Anisha. I told her, I haven't done anything. You called your God. He's done it. So now I know for a fact that anytime she's in trouble, she's going to spread the news to her grandchildren, to her friends. All you got to do is call your God, and it will work. So these are the stories that I formulate, and this is how I get my patients.
Thank you so much, Neerja ma'am. Because
this is the merit for being a volunteer, you know. When my patients get a baby, they call me and say that you have become a nanny now. And many kids.
But thank you for sharing these stories, because self-pity is not a way out. You will not be able to fight this disease. Like Rekha ma'am said, we need to talk about other things as well, and not just the treatment and the side effects. So I'm going to take very short concluding remarks from all of you, because we've completely run out of time. Dr. Mishra, for all the patients who fear about a recurrence, can the doctor, you can tell actually who'll get the recurrence, right? So does it make it a black and white, or is there still a lot of gray?
First thing, I will thank Rekha ma'am to enumerate many things about the survivorship, and then Neerja ma'am. I will request Christina, Neerja ma'am, and Rekha, tell one line about your message, a crisp message you want to give to inspire the new patients. After I speak about the this thing, so I was saying, so once patient is being treated, it's a new normal for the patient. If I summarize, new normal for the physical thing, new normal for the family, new normal for the emotional thing. Then the second aspect we have to see in these patients is that the follow-up schedule in these patients. They have to stick to a follow-up schedule, because there is always a risk of recurrence, what question you are asking, Anisha. And there are some cancers which are aggressive, some cancers which are indolent. So according to those nature of that cancer, nature of the disease, depending on the biomarkers, we make a follow-up schedule in these patients. And during these follow-up schedules, sometimes patient will just undergo a clinical examination only, and sometimes there may be some investigation. Usually investigations are scheduled at 6 months, 1 year, or 2 years duration. Then the third thing, after the treatment, these patients may get some physical problems like lymphedema problem, some of the problems that Rekha ma'am was enumerating regarding the body image, regarding the sexual life. So we have to take care of those all issues when they meet us. We have to discuss, and we ask some of those questions, how they are coping. Now, a very important aspect of the surgery, which I have not told you, that type of surgery, there is evidence now, enough evidence, I mean initial evidence you can say, and that's the enough evidence, that type of surgery also influences the survivorship. If patient has undergone a conservative surgery, means breast has been conserved, these patients have better life in terms of family life, better in terms of sexual life, better body image, compared to the patients whom the whole breast has been removed. And complete breast, when we have done a mastectomy in combination with radiotherapy, that's the worst group. So we always try to conserve these patients, and then patient has to be aware about these options. And then I will request you all, as you are talking to the patient, that they should, when given the choice about the conservative surgery, they should choose this, because most of the time when we talk to these patients and we give a choice that you have both the options of conservative surgery and removal of the breast. But because of this social media, because of the internet knowledge, because of the Google knowledge, they always say that we don't want the breast right now. Now, when they are surviving in the long term, that has a very big influence on their body image if they are not having the breast. And the last thing last aspect is that family issues after the treatment. I mean, the caregivers, we have to give adequate, listen to the adequate things to the caregivers. I mean, husband has been coming, he has lost so many things in his office, he is tense, he cannot enumerate these things to the wife who is suffering. So those all aspect, financial aspect, these all aspect has to be seen in a survivor. I mean, after the thing. And then now I want to listen just a tagline, inspirational line from all of you three, if you can tell.
So let's start with Neerja ma'am.
You know, Neerja ma'am is a Gemini. So this too shall pass. Second, one day at a time. Third, laughter is the best medicine. Fourth, God is great. That covers everything.
Yes. Yeah.
Rekha ma'am, what's your tagline?
I think you should live each day as it comes, and then you aspire to inspire before you expire.
Okay.
Christina,
excellent, Rekha.
What's the one thing you want to leave everyone
So
with?
Neerja ma'am and Rekha ma'am took my line, which was live one day at a time. So I had to quickly think of another one. I think my tagline would just be visualize the future you want for yourself. So with or without the disease, with or without a positive or negative prognosis, visualize the future and the life you want for yourself.
Very good. I would like to ask one question to Dr. Saab. You know, because till today, I have most of the time heard that removing the breast is the best thing because it will mean there will be less chances of recurrence. But if you retain the breast, so if you conserve the breast, you have more chances of getting the recurrence. What is the truth?
No, so I will correct right now. It was the concept. And in fact, general surgeons who are not in the breast cancer surgery field, they still tell the patient that you get the breast removed. Now, there is enough evidence, initial evidence of follow-up of these patients, that patients who have undergone breast cancer surgery, I mean conservative surgery. Now, there are many technical things in the breast conservative surgery. Those all have to be followed. So if you just compare breast conservative surgery versus mastectomy, breast conservative surgery patients have very good quality of life in comparison to the mastectomy patients, and it is also affecting their overall survival.
All right. So we've got a lot of information and a lot of inspiration from our speakers today.
Anisha, one last thing. In Chennai, I was told you must do a mastectomy. When I went to Bombay, the doctor said he got an inch tape and he said, okay, we're going to do a lumpectomy. And you know what I did? I am a drama queen. I got down on my knees and I begged him. I said, please do me a mastectomy. And he said, why? I said, because A, that's what I was told in Chennai. And B, I said, because it might come back again. And he just said one thing. He said, listen, there is no research to show that it comes back in the same breast. Different matter, I've got it on both breasts with a gap of 7 years. Second primary, not secondary. And the second thing he said was, there's no research done to prove that it's going to come back. And he said, don't forget, it's a larger wound, it's a larger area. And like Anand said about the mind, that you lose a part of your femininity, whatever. There's a friend of mine who wears a dupatta on the part where the breast is in there and she's perfectly fine with it. Plus, in 3 generations, we've had 40 cases of cancer in my family. And the fact of the matter is that if you are positive, you can, I promise you, do anything. I was not expected to be here 23 years later. They told me there is no treatment for me in India. Go to France, go to America for stem cell research. And I couldn't because my twins were only 7. So have a goal. Just move on. Have faith in your God, in your guru, in your family, in your friends, in yourself. You can do it. And go Zumba.
Thank you all for joining us today and sharing with us critical knowledge as well as your inspiring stories. I'm sure you give a lot of hope to a lot of women who are struggling today. Thank you all for joining us, and do sign the pledge. We'll be back again with another episode discussing many more issues surrounding breast cancer. Join us again.
Thank you so much.
Thank you.
Thank you. Thank you.